Are you tired of quick fixes that promise transformation, but leave you feeling more disconnected from your body than ever before? Welcome to the Beyond Medicine Humanized Care for Women of Influence podcast, where we go deeper than surface level solutions. I'm Dr. Maria, a functional integrative physician specializing in women's health, metabolic dysfunction, and hormone balance. Here, we will uncover the root causes of insulin resistance, PCOS, thyroid, and adrenal issues. And we will explore how trauma, stress, and anxiety impact your well being. Because your body is not a microwave, it deserves personalized and passionate care that honors its complexity. Let's embark on a journey to reclaim your health one conversation at a time. And today I have with me Lydia. She is a registered dietitian out of the California area. And we are going to be talking about one of my also favorite topics, which is the impact of early trauma. So early in your life in health. And specifically, we're going to talk about how that affects the influence of autoimmune diseases. So, welcome to the show, Lydia. Welcome to this chat. Did you just want to start by introducing yourself, like who you are, what you do, your passion, hobbies, anything that you want to share about your persona with the listeners?
Absolutely. So first of all, thank you so much for the invitation. This is the first health-related podcast I've been on, so that's exciting. So my name is Lydia. Like you said, I completed my dietetic internship in Houston, Texas. I'm a Texas A&M Aggie, so I know I'm in California, but I really lived anywhere and everywhere. I love traveling. The reason that I eventually picked nutrition as my career is actually, it's not where I started. I started in biology. I thought I would become a doctor. And over time, I started to think, do I really want to become a doctor? There's nothing wrong with being a doctor, but is that really what I want to do? And I started thinking, I need to be in healthcare, but I don't want to be a nurse, but I don't know if I want to be a doctor. And I love that your podcast is about uncovering root causes, because nutrition, to me, is the root cause of so many of our diseases and problems and issues. And I had a very serious back injury during college, so I decided I need to take a blow-off class to have an easy semester. And so I thought nutrition was a blow-off class. I was like, I've taken organic chemistry. Nutrition's a blow-off class. And turns out not only is it not a blow-off class, but it was what I wanted to do with my career, because it was the thing that was missing in every single thing that I was learning in biology, all these diseases, all these conditions. And so it was a no-brainer. From there, my path was set. And then now here I am, registered dietitian, and on this podcast with you. And yeah, there's so much to uncover when it comes to nutrition and its connection with autoimmune diseases and really any disease. So I'm super excited to unpack that.
Yes, and I completely agree with you. I think that a lot of the times when we think about nutrition, people think of diet and the right diet. And I think that it's really important that we clarify. So it's the way that you nourish your body. It's kind of like this. Again, it's the lifestyle, the ritual, the way that you are going to do it most of the time that goes beyond how your body might look, but the impact of what the food that you're consuming has on your health, that a lot of the times goes beyond what we can see in the eyes. So it's not only about quantity or like macros, but it's also like quality. And there's a lot of things that I think that go into. So or let's start to unpack it. That's what I should say. So when we're talking about early childhood trauma or early in life, I already said childhood, but early in life, what specifically are we referring to? And why is it that the events that happen early on in our life perhaps have a greater impact than what happens when we're in our 30s or 40s or 50s?
Sure. You're absolutely right. The early childhood and early life is super important and is different from our life stages later. It's not that what we do in our 30s doesn't matter. Of course it matters. But those first few years or decades are when our brain is the most plastic, meaning that it can change the most. It's when we are building the foundations for everything in our future health, our bone health, our mental health, the way that we cope with things. It's laying that foundation. We're building a house and we're laying the foundation. On a deeper, kind of more scientific level, what we're looking at is epigenetics, which is a term. We think of DNA as the code that writes our body, that codes what we look like and what we sound like and what diseases we are more predisposed to. But epigenetics, it's if genetics is the script, epigenetics is how we read it. It's how those words on the page are put out into the world. So you can have two identical twins with different outcomes, of course, because they have different epigenetics, right? They have different lifestyle choices. They have different things happen to them, different experiences, different exposures. And so all of those things shape that epigenetic landscape that carries into adulthood of what we experience, good and bad. It's not that that can't be altered later in life. It's that this is the time where we see the most changes fastest. And anyone who's ever raised children or seen children grow can tell a lot changes. I feel like I wait 3 months and I see my friends' kids and they're a whole different person.
Yeah. Yes, absolutely. And you mentioned a couple of things, right, that I'm going to go back to.
Perfect. Yes, that was broad strokes.
Absolutely. So neuroplasticity, and that's the big word. Maybe some of our listeners know what it is. Maybe some know. But the way that perhaps we can see this is like Play-Doh, right? And in the early years, it's almost like we're giving form to this Play-Doh, and we can make of it, again, a triangle or a square or a rectangle. We can even make it like a donut shape. And then playing with the Play-Doh and giving it a form, right? If you think about it, a square is not the same as a triangle. And you might not necessarily be able to fit it everywhere, depending on the size and the shape. So if we think about our brain being formed like Play-Doh in different ways, that will impact the things that you can do in life, the way that you can behave, the way that you interact, that you see the world. Taking into consideration that because it's Play-Doh, when you are 40 or 50, you can choose and decide, I don't want the square anymore. I want to try life now with a triangle instead of a square, because I think that the triangle will fit me better. So I'm going to explain it like that in terms of the neuroplasticity. And then also a buzzword right now, which is epigenetics. And people sometimes, again, confuse it with like genomics or genetic testing. And I think that yes, it's part of our DNA, but then it's like the specific changes in your DNA that can turn on or off genes that you already have, right?
Right.
So we're not changing your genetic. We cannot alter it, but we perhaps can help genes that would be beneficial to you turn on, and then again, improve and optimize your health and your function.
Yeah, absolutely. That's a great way of explaining it. And I love that you integrate not just the scientific, like the disease, the traits, that side of things, but also the behaviors. Our behaviors are very heavily shaped by those early days. I feel like half of what adults do in therapy is figure out what happened in their childhood to make them react a certain way. And it can be a very valuable experience to look back and go, okay, what was this? Is my foundation crooked? And do I need to maybe, as an adult, it's not hopeless. It's just we need to know what's wrong first. And so we can identify, okay, this is why stress at work causes me to do this when I come home, is because I've laid this foundation, because that's how I coped and dealt with it in those early years. So they're very important. And I think that it puts a lot of pressure on parents, of course, when they're raising children, but it's also so hopeful. Like you said, if you want a triangle, you have a square, everything is so moldable when you're younger.
Yeah, yes. And I think that one of the things that I try to emphasize is this: we're not fixing because we're broken.
Mhm.
Perhaps one approach can be maybe what was working 10 years ago was helping me survive. It was beneficial, but we all evolve, we all change. Maybe we're not in the same environment, in the same work, with the same relationships, with the same people. And now it's time to evolve. And maybe certain behaviors now are not helping me do what I need to do or be who I want to be and developing that
Absolutely.
authentic self. And I think that the other thing that I'm going to mention is when it comes to childhood development, absolutely no parent's perfect. Every parent, if you're listening to me, every parent in some way or another, you're going to screw it up. Just take the weight and the pressure off. You cannot be perfect. In one way or another, we're going to screw it up. But I think that as adults, we can make the choice, the conscious choice of saying, I'm going to examine my story
Mhm.
and who I am, where do I come from, what influenced me. And from that story, again, start to unpack, oh, maybe this is why I might react a certain way in not even negative, right? It might be also things that lead to positive behaviors and positive relationships. So there might be things that are protective and that will continue to be protective towards your persona that I think that we can continue to hold on to. And then that's where I always say start with awareness and introspection.
Absolutely. And yes, I love that you said that things that worked then don't always work now. I attempted this after grad school to work at the same intensity and at the same rate, and I ended up with 3 stomach ulcers. So, what was working to get me through grad school in that temporary time, which was a good thing, it helped me get through it, it helped me get good grades, it helped me finish my thesis, was not helpful when I settled down, got married, and had to work with someone else in my schedule. You can't go at 130% for your whole life.
No,
So you're
no,
right. There are things that are positive, even that we still have to shape as adults. Even if there's nothing wrong with us, it's that is this the best strategy for the goals that I have
right, right.
now versus before? And that, yeah, that is so important to remember is that it may not be something wrong with you. It may be that we need a new plan. We can't have the same plan our whole life.
No, and I think that also paying attention to your body by itself will, I mean, a lot of people say it, oh my God, I don't have the same amount of energy that I had when I was in my 20s. Well, because your body is telling you to slow down.
Yes.
So even just paying attention to something as simple as that, and then going into this new rhythm can create a lot of difference. So let's unpack now when we're talking about autoimmune disease. I think that people are familiar with things like thyroid problems, like Hashimoto's,
Yeah.
insulin, so type 1 diabetes, so
Mhm.
problems with insulin. A lot of the ones that affect the joint, like rheumatoid arthritis, lupus. So tell us a little bit of what are autoimmune diseases and what's happening in our body.
Yeah, autoimmune diseases are a very complex and diverse topic because you're right, you have every body system could be involved, from your hormones to your joints. Just speaking personally, I have celiac disease, and so that
Mm,
affects my GI tract, it affects my joints as well, and even my mental health, which is something I didn't realize until I got off of gluten, which is the trigger for celiac disease, and realized, "Oh, I don't need anti-anxiety medicine. I need to be off of gluten for my
mm,
specific condition." And so it affects the whole body. But what is an autoimmune disease? Auto is the root word meaning self, and immune is obviously our immune system. And so autoimmune diseases by and large are when your body attacks you, thinking you are the problem, whether that's your small intestinal cells, which is the case with celiac disease, whether it's your the cartilage in your joints, whether it's whatever it is, your thyroid cells, your body thinks that something in you is the problem and it attacks it and it damages it or it changes it. That's another thing. It could change the way that your body functions, if not destroying a certain cell. And what this does over time is it can result in these symptoms that we see. And a lot of people want to know, well, how does your body decide one day, oh, wait, you're the problem, me is the problem? And that is highly dependent on which disease we're studying. But by and large, we do know that most autoimmune diseases have a trigger. We may not know what that is yet, depending on how far advanced the science is. But we do know that they have to have some kind of trigger because very few people are born with an autoimmune disease. It can happen very early, but very few come out of the womb with it, which tells us that this is something that maybe we had in our genetics, a predisposition, and maybe something triggered it, or maybe something happened to us that changed that epigenetic expression, and it happened to us. And so that's the difference between being born with a cleft palate and being born with an autoimmune disease, or being born with the potential, is that an autoimmune disease is your body attacking your own cells.
Yes, yes. And I think that it's very important also to mention that, so a couple of things about autoimmune diseases, some of them can have like flare-ups.
Absolutely.
So think of like your rheumatoid type of like diseases like lupus or arthritis, but some of them, which is also autoimmune, like type 1 diabetes, is not going to have those flare-up type of moments. And I think that at least when I approach the care of patients that have a condition that can lead to a flare-up, I think that they have to be even a little bit more conscious of what they do every day to try to diminish those flare-ups. So it has a different impact that somebody with type 1 diabetes, that once the condition is well managed and they know everything related to counting carbs, insulin, all of these good stuff, it's a little bit easier to manage that some of the other autoimmune diseases. And I think that the other thing that I want to say is some of these autoimmune diseases is almost like you can put them to rest, to sleep, right? Versus, in my experience, when it's an autoimmune disease that involves hormones, again, like type 1 diabetes or thyroiditis, these are a little bit different because I always like to tell the patient, it's not that you're taking medicines. It's more like we're giving your body the hormone that it needs so that it can function well. And like you said, there's like this big spectrum of autoimmune diseases. And the approach to the care might not be the same. And I just want to mention that because sometimes in my experience, patients hear something and then they globalize it and they think that everything applies to everybody, and not necessarily.
A really good example of that actually is gluten. A lot of people hear, oh, you gave up gluten and your body healed. And they think, I need to give up gluten, or I need to give up whatever the buzzword is, sugar, whatever it is, I need to give that up. And it's possible that could benefit them depending on what they're dealing with. But we can't assume because, like you said, it's such a diverse group of conditions. And one thing may not work for the other. And especially when you're absolutely right, when diseases have ebbs and flows, as much as it is frustrating for me to never be able to eat gluten again, it's the same treatment my whole life. It's the same treatment, but it can be very draining to try and figure out how do I get into remission or the closest thing, because remission is a tricky word with autoimmune disease. But a lot of people like to use it, and so I honor that because that's how it feels. I'm free. But yeah, it can be exhausting trying to search for that freedom from it when it's possible. Main thing that I want to agree and say again is you are not going to have the exact same treatment for any two individuals. And it's perfectly fine to say, oh, so-and-so has this disease and I have the same one, I'm going to try this. But just keep in mind that our bodies are so different. Even if one person is 40 and one person is 20, those treatments might look radically different.
And to add to that, I have had sometimes patients that tell me, well, put me on X medication because that worked for my friend or family member. And then they're surprised when perhaps, oh, I don't know, something happened. It worked for them, but it didn't work for me. And again, our bodies are different. And
Yes.
they even respond even to medications, which there's a lot of research that is done. Your body might respond to medications or certain medications in a different way that somebody else that you know. So personalization, absolutely. So now so now that we have an idea, early trauma, what we're talking about, autoimmune diseases, what are we talking about? So how
Yeah. So how are these connected? I think that we have to first start with what is some people use the word trauma. I know that there's also a word or a set of words called adverse childhood events, and these are
Mhm.
specific events related to abuse, neglect, and emotional stress. 70% of people to 80% of people have at least one. So if I have one, right, these include things like abuse, right? And they do not discriminate, which I think is great, between physical, emotional, and sexual abuse, because really everything is physical abuse because it will manifest itself in a physical way for most people, whether it's through bodily stress, heartburn, stomach hurting. I like that they don't discriminate. It's not like one gets more points than the other. Parents divorcing, death of a close relative, those are all included in these adverse childhood events. And of course, when we have something bad happen to us, our body reacts. When we are grieving, we feel the grief in our body, right? When we are scared, we feel the fear in our gut and we feel it deep inside us. And so our body has to react to what happens to us and often tries to protect us from it happening again, which is a beautiful thing that our body does for us. But sometimes it is not beneficial in every situation, which we can definitely get more into. But the theory behind are autoimmune diseases and early childhood adverse events connected actually was studied in a Kaiser study of, I believe, over 50,000 people. And so Kaiser is a big network of healthcare. It's just a huge conglomerate of healthcare practitioners, and it's mostly based in California. And so they studied their people to see, it was a prospective study. So they started the study and said, okay, let's see how many of you experience an adverse childhood event and then later go on to develop. They specifically studied, I believe, thyroid and T cell related autoimmune diseases. So they did not study specific ones like lupus or what, but they studied these in particular. And they found that of the people who eventually developed that autoimmune disease, 70 to 80% had greater than 2 adverse childhood events. Now, we have to consider the structure of the study, that we can't say these caused it definitely. But this
Mhm.
tells us, okay, this is something that is probably connected, that we can look into, that now we can study more. We have a good case to study it more. And we have. And we found that there are connections between these early childhood adverse events and even late adulthood, or sorry, not late adolescence, and developing these diseases even in your 30s, 40s, 50s, and 60s. It goes on and on. And so I have some theories of why this may be, and the literature also does. But what are your thoughts on this yourself? What is your experience with the literature in this way? Because it is so fascinating.
Yes. So definitely one of the things that I do with my patients, so standard of care, I always screen people for depression. When I started my own practice, yes, I do what is called a PHQ-4, which
Mm-hmm.
helps me identify people that could have anxiety or depression that is clinically significant. That means that they need help, treatment. But then one of the other things that I do is that I have them complete the ACE questionnaire, um,
Yes. Yes.
which is 10 simple questions. And even thought I'm not a therapist, I'm not going to treat trauma. I do. So the reason that I do this is because I do know that one, this will affect your health, but not only will affect your health, two, this will affect how fast your body will heal.
Mm-hmm.
And we know that if we do not process all of this, if we do not help our nervous system regulate again, if there's some things that we do not do, That is the reason why your friend gets a head cold and in 2 or 3 days it's better. You
Mhm.
get a head cold and you have symptoms for 2 weeks. That
Yes.
is the reason why some people with mold toxicity are 3, 4, 5 years in treatment and others not. That is the reason why people that have Lyme titers might not develop symptoms, while others that do might develop symptoms.
Yes.
That is one of the reasons why you can, some even from the same family, which we know that people that come from the same family also tend to have very similar lifestyle. It would be a little bit right left, but it tends to overall be similar. And you can have siblings that might be more sick and more prone to illnesses and going to the hospital than others. Me personally, people that have heard me speak of my story, I was a child. I grew up with asthma coming in and out of the hospital. And overall, my immune system is a little bit sensitive. As an early adult, then I would get anaphylactic reactions. I have to be very careful about that. But then also, I grew up with type 2 diabetes. I grew up with chronic back pain. And when you think of a child, these are not illnesses that we tend to see in kiddos, maybe asthma,
Yeah.
right? That's the outlier. But the other ones, we don't tend to see them in kiddos. And growing up, I did a lot of my own, okay, I need to change the way that I eat and I exercise and all of these other things. And not even in medical school was I taught about the impact of trauma. And then once I learned this, probably maybe at this point, maybe 10 years ago, I read The Body Keeps the Score. And there's
Hmm.
also some other really good like books and literature out there. I really think that part of what was happening in my body, the environment, my A score without going into details is 8 out of 10. So that lets you know it's pretty high. My body was just child responding because this is the other thing that I want to mention. You said was what a lot of the times we think about what happened to you, but then part of this is what did not happen to you that should
Hmm.
have happened, right?
Yeah.
That you should have had. And those are real things. And a lot of the times we see this as related to negative behaviors, people that homeless, go to jail, are incarcerated. But
Mhm.
I am a physician. I graduated magna cum laude from medical school. So not everybody that grows up with a lot of adverse childhood events fit that category of you're going to end up right in this other category. And there are some of us that we're functional, what society would put as functional. And I think that then there's even less awareness of, oh, maybe there were things that happened and not happen to you that we need to look into. Um,
Mhm.
definitely, as a physician, I ask for the ACE questionnaire. My experience has been that there's still lack of understanding of no, this truly will affect you. And when it comes to trauma, and especially complex developmental trauma, people might think that going to therapy a couple of times and maybe a year, that will make a difference. And it will. But I think that complex developmental trauma, the way that needs to not only be treated is a little bit longer, but I also feel that you have to develop a great sense of awareness of this is what happened or didn't happen. This is how this is affecting me. And really start to create a life that is very different. And the last thing that I'm going to say about this is also, so I practice acupuncture. And one of the books that I have is called The Tao of Trauma. And it is specifically about how acupuncture can help the body. I'm not talking about the mind and the memories and all of that, but
Mhm.
how can acupuncture help the body heal of how these experiences that were not positive, that provoke your body to react, that change chemicals, that change hormones, how we
Mhm.
can use acupuncture to help our bodies heal. And a lot of the times, I'm using points in the ear that are to help the body heal in that way that I don't even tell my patients, this is for this, is for that. But we do know that there are points that can help with a lot of the effects that trauma have in our bodies and in our behaviors. So I completely believe in it.
Yes, and you don't just have to believe in it. The literature supports it. And there's a lot of reasons that we are exploring as to why that could be. Going back to diseases like celiac disease, we know that there are 2 to 40, we don't know exactly how many, genes that influence whether or not you develop it. About 30% of the population has at least one gene that is associated with developing celiac disease. So why don't 30% of us have it? And that is the question that we are trying to answer for each of these diseases. Multiple sclerosis, thyroid disease, Hashimoto's. We're trying to figure out what is that trigger and can it be reversed? And can it be reversed through behavior? Can it be reduced through learning? I love the phrase, your story. I used to work with veterans a lot, and they are very hesitant to learn about their story because a lot of their story is something that they don't want to read, which completely understandable. But if you don't read your story, it's like living in a house and you don't know all the rooms. It,
Yes.
you,
Yeah.
and some of those rooms, there's a beautiful song about it, a rap song called Mansion, and it's a man describing his trauma in terms of a house. And
Mm-hmm.
it, that is how we figure out who am I and why am I like this?
Yeah. Yeah.
And who do I want to be? And
Mm-hmm.
maybe that's possible. And so with autoimmune diseases, it's a bit harder because there is a genetic component as well. It's not just about what has or has not happened. It's also, we do have a genetic predisposition a lot of times with these conditions. But there are many ways that we can use nutrition and diet or use behavior and learning our story to help improve it, not the disease itself, the symptoms, the flare-ups. I know that my ulcerative colitis patients always experience flare-ups when life gets hard because why not make it harder? And that makes complete sense to me because you have higher levels of cortisol due to long-term stress. Your body is thinking, okay, I got to protect, I got to protect Maria. I've got to protect Lydia. And the ways that our body does that are sometimes not positive for us in our day-to-day life. If we can reduce the triggers in the environment, it is possible to experience improved outcomes in our autoimmune diseases, even if they have no cure. A lot of type 1 diabetics, when life gets hard, it gets harder to control their blood sugar. And they think, I've been using this insulin for how long? The same dose, and it's not working. But we know that stress impacts your blood sugar. We know that stress and cortisol impacts your hormones, which especially women with type 1 diabetes struggle with that as well. So it, I guess the thing that I want to say most is that there is so much hope. I know that disease, I've talked to many people who feel like disease is inevitable, that it is
Mm.
permanent, that it is unchangeable. And there are things in life that we cannot change because of whatever reason. But that is not most things, right? Even if we delay the onset of type 2 diabetes by 15 years, that's far from inevitable. That's far from no control at all. Maybe you will get it eventually, but maybe you don't have to get it right now or in the next 10, 20 years. Maybe you will have celiac disease for your whole life. Maybe you will have multiple sclerosis. But how can we prevent it from progressing, flaring up? And nutrition is a huge part, but I've actually found that nutrition and mental health are so connected. So connected. A lot of people don't need a dietitian. They need a therapist and a dietitian.
Yes, absolutely. So I want to go back to a couple of things that you mentioned. One is the health.
Yes.
And I think that is absolutely true. And this is what I want to say. Sometimes people have this I'll just do it myself.
Oh, yeah. Oh, yeah.
And even when it comes to home, yes, there are things in your home that you can do yourself. Maybe you can clean, maybe you can paint, maybe you can decide I'm going to change how the furniture is reorganized. But the reality is there are projects that you need to hire people and you need to
Yes.
bring people.
Yes, absolutely.
Right. So when you ask for help for your own health, that does not mean that you're weak or
No.
that there's a problem with you. That means that you are being as smart as wise as saying, I don't know, like right now, I have to fix the front door and the floor here in the home. That is as simple as me saying, I don't have the knowledge, the skill, the strength to move an 8 feet door by myself and put a new one and redo the floor. I just don't. So I decided to hire somebody. That does not mean that because I do not have that skill and that knowledge and that capacity, or that I'm just choosing not to do it. That does not mean that there is something wrong with me. I'm just like, and the other thing that I want to say, sometimes what we do, even with our homes, is that we start to procrastinate and just leave it there and leave it there and leave it there. And eventually the home has deteriorated so much that the only thing that can solve it is that you have to sell it at a very low price to an investor that is going to come and is going to fix it so that it is livable. So if you are one of those people that, and I hear this a lot of people contact me and then they're like, I'm not ready. I'm going to wait. Or they make an appointment and then they postpone, they cancel the appointment just a couple of hours to their appointment. There will be a cost to procrastinating your own health, just as there is a cost when you procrastinate the taking care of your home for whatever reason. And a lot of the times, I can understand sometimes financial reasons, but when people tell me about time, I am like, no, you can make the time. It's just a matter of then prioritizing it. We all have the same 24 hours a day. The other thing that I want to say is that sometimes also patients get defensive, or maybe defensive is not an appropriate word. They get a little bit touchy because then they say, it's not in my mind. And it's because they feel that you're telling them that the diarrhea is in their mind and that they need to see a therapist. And I'm like, no, it's not that it's in your mind, but there is a connection of hormones and neurotransmitters and all of these substances that your body is releasing, right? Naturally, that you're not even aware of, that yes, it's provoking the diarrhea. So there is, as you said, a really big connection. A lot of the times we separate it. So, the body, neck down, the head, and we don't understand that what's happening here is affecting what's happening down here. What's happening down here is affecting what's happening up here. I want to say this. It's not that we're saying that it's in your mind, because sometimes people just get a little bit defensive and touchy about it. But what we are saying is that paying attention to what happens in your mind, what happens in your body, can help you then decide, maybe I have to pay it. I need help and I need to pay attention to this specific area because yes, it is affecting me. So when I do not sleep well, it's not only that I'm tired, it's that especially if it goes on for a long time, I start to gain weight, which is a very simple example. But basically, that is my body telling me you're not sleeping well because you are worried at nighttime. So your cortisol is high. Therefore, I'm going to put fat around your belly.
Yes, your body trying to protect you, but not necessarily what we want. And I think as clinicians, you as a physician, me as a dietitian, we need to probably take a moment and understand, and I'm sure you've experienced it given your history, and me with my history being gaslit by
Mhm.
healthcare providers telling us it is all in your head. I was told you just need to drink more water and lower your stress. That's what I
Mhm.
was told for 10 years
Mhm.
while I suffered.
Mhm.
And I understand why patients are very sensitive to that. And so I love the way you described it. It's not that it's all in your head. It's that your brain, your mind is connected. They're connected and it's in both.
Mhm.
And you can't separate them. And I always try and reassure patients like this has happened to me. When I'm anxious, my stomach hurts. And when my stomach hurts, I get anxious, even if I have nothing to be anxious about, because it's a very primal thing to feel that gut feeling. And it doesn't mean it's all in my head. It means that they're connected. And doesn't
Mhm.
that show just how disconnected we view it when we can't even say your mind influences it without people assuming that's all we mean? To that separation that it's automatic. And I love
Right.
that breaking that down.
And I had a patient that came to see me a couple of months ago. She was having like nausea, chronic nausea. And she was also having problems with her sleep and her anxiety. Because of the nausea, I had to like, okay, what could be going on? So I needed to do like a workup. Besides, while we do this, let's help you with your sleep. And she's, how is that going to help me with my nausea? And I'm like, because then they see it as this, it's in my head. And I'm,
Mhm.
no, that's not what I'm saying. We need to fix your sleep. It might not take away your nausea, but if we fix your sleep, there's going to be so much other things in your body that is going to improve that perhaps you feel less nausea. Or even if that doesn't happen, at least your body is rested in a way that now your body can heal. Because
Yeah.
part of what happens is if your body is chronically sleep deprived, stress, not eating well, not drinking enough water, air pollution. So all of these stressors, right? All of these stressors that your body is exposed to. Then part of what happens is that the natural healing capacity that your body has, it's almost like it becomes squish, right? So you're putting lack of sleep on top of it, anxiety, stress on top of it. I'm not eating well because I don't have time. I am exposed to air pollution because we cannot control everything, right? So you start to put all of these things and starts to create weight on the natural healing capacity that your body has. So sometimes part of what really helps is if we start to take that weight off, those layers off, and it's not that the issue is just the air pollution, it's that those things are creating this heavy kind of like sandwich mass on top of it. And if we start to take off that, and then the body's healing capacity can now go and blossom in a very beautiful way. So I also want to mention that because I think that it's important to understand that it sometimes is our bodies have the capacity to heal, but sometimes we need to just help it get to that point.
Yes.
And I think that when you mention like flow, and you said something that I was also thinking is, what are you in control of? What are those things that we're in control of that we can help our body heal and blossom in a very beautiful way? Knowing, as you said, we cannot always live without completely illness free. I think
Mhm.
that there's this natural process of the body decaying, that there are some things that will happen. Yet within that, if if we are keeping the flower blossom, then we're watering it and paying
Mhm.
attention to it, the flower has a greater probability. And that's where tenderness and compassion comes in. But if you feel like, oh, it's not in my head, well, let's talk a little bit more about this. And can we approach this with curiosity, tenderness, and compassion? Not because your head is a problem and we need to fix it, but just because
Mhm.
there's this connection that we can explore and then just help it blossom.
Yes. And let me say, when I first learned about the mind-body connection, as you're describing it, at first I was like, this is like woo-woo. I don't know about that. I was very much, nope, these things are separate. We have science and then we have whatever this is. But when I learned about epigenetics, DNA methylation, turning genes on and off, the way that our body physically can change the way DNA is expressed, not the DNA itself, but the way it's expressed. It's not woo-woo science. It's real. And just because we don't have a complete understanding yet does not mean that this is made up, that it's snake oil. If somebody tells you it is fake, I'm sure that there are people who utilize this framework of thinking about the brain to they don't include all the information, but overall, this is real. This is something we are learning more about every single year. There are more and more articles about it. And the analogy of a house is such a good one because we all know inherently that if we do not put new paint on our house, if we don't fix the foundation, if we don't change the oil in our car, we all know it's going to break down. Nobody would question that. But when it's our own body, we are so much less likely to give it the care it needs. And so I always encourage people, look outside of yourself. View yourself as someone you are the caretaker of. And a lot of people say, of course I view myself that way. No, you don't, because you didn't take your meds this morning. Who did? Your dog. Your dog took their meds this morning, and your dog cannot take their own meds. So I know that you are not caring for yourself as if you are someone you are responsible for caring for.
Yeah.
If you were, you would have made that time to take your meds this morning. And that's not a criticism of character. Generally, these people are doing that because that is their habit of caring for others first. But we need to realize that selfishness is not putting your needs as a priority. Selfishness is putting your wants before other people's needs, not putting your needs before other people's wants.
Yes. And I think that's where, for people that have been exposed to a lot of adverse childhood events specifically, and we know that the power, the empowerment that I can choose,
Yes.
I can do the self-sufficiency of empowerment, of doing things, of taking care of myself, that gets messed up, right? And a lot of the times there is a strong victim mindset that has been developed that does need attention, right? That we do need to like break that mold of, okay, is it really that I can't? Or is it more that throughout life, all of these things had happened to me and I have felt so powerless that when it comes to my health, taking care of myself, I also have that same powerlessness feeling. It's just that it is in a subconscious way. So it's so back there that I'm not even aware that is driving my behavior and my choices. And the last thing that I'm going to say as we're coming to an end is, so I had somebody that told me, I'm eating my vegetables and I'm eating my almonds every day, and I understand the science of exercise, but still I have high cholesterol and this is happening and this is happening and I have metabolic dysfunction. It's because of the stress. And I'm like, it is because of the stress. And then this person told me I have this responsibility and this responsibility and this and that. And I didn't say anything, but I'm like, okay, so if you are already aware that it's a stress, and then you say that you have all of these responsibilities, do you really need all of these responsibilities? Are these things that you truly can say, I'm going to let go and I'm going to create more space? Because as I create more space, again, you can choose to order in your home, or you can choose to have what I need, create space where I can walk and light from the window can come in, right? So
Yes.
I think that's really important.
That is something that in my clinical practice and I see what I call eldest child syndrome. It's not always the oldest child, of course, but it often is. They feel this responsibility towards everybody but themselves. And it is hard to prioritize yourself. It is And it's not a character flaw. Remember, it's something that helped them in their early life. It's something that was beneficial, but no longer is serving them. And that is what I think I want to emphasize, is that, yes, it can be the stress, but yes, there is hope. But yes, you're going to have to change something that's super uncomfortable. If you've ever done a big renovation project, you were uncomfortable for a long time. And it is not fun. But I can tell you, as someone who's on the other end of a health crisis, all the sacrifices, all the work, all of the effort to figure out what's going on up here, to learn my story, to see patients learning their story has been one of the most rewarding parts of my practice, because I always see an improvement, even if the body looks the same. Because remember, it's not just about how the body looks, it's what's going on inside as well. They glow differently when they know their story, and when they're able to use their story to their benefit and not to their detriment. It's beautiful. And it is one of the most rewarding things about being a dietitian that I never thought would be part of it. I thought, okay, I'm going to give them a calorie count and get this much protein. And granted, there's a time and a place for protein recommendations, but by and large, the most rewarding thing has been seeing people connect the mind and body and see themselves with so much compassion and tenderness, and be able to change the way that they care for themselves. And they often end up getting to care for others even more, because they have more energy, more space, more time, better health. And it's just such a beautiful thing to see. And I hope that medicine moves more towards that direction of seeing that connection. And I think that articles like the one I read about the adverse childhood events and autoimmune diseases won't surprise us anymore. We'll be like, duh, that's obvious.
We already knew that.
Yeah. And I'm hoping that will happen in the future, so that we can have more comprehensive care from the start, not when it's already happened and we have to tear down a wall in the house. Hopefully we can see the foundation, have a little crack in it, and go, I've been tripping over that for a couple weeks. I should probably look into what I want that foundation to look like. I'm excited about the future and how dietitians are being trained now in their internships to look for things like that. Not to treat it, because that's outside of our scope, but to look for ways to help our patients more comprehensively. I'm excited and hopeful.
Because again, sometimes they are not aware. But if we are working with a clinician that has an awareness, even if that's not an area of an expertise or within our scope of practice, at least then we can bring it to the patient.
Yes.
And start to create some awareness with them, and then provide them some resources. And that by itself can just help.
Absolutely.
So we did not go into talking, which I wanted to be able to do that, but we don't have time, at least not for this episode, in terms of there are things that people can do that have autoimmune disease to perhaps, again, just even question, okay, could there be things that happened early on in my life that is not, again, that if you do trauma therapy, EMDR, IFS, those type of modalities, immediately your autoimmune disease is going to disappear, right? But that if we attend to it, again, this natural healing capacity that our body has and the balance that your body should have, some of that can be restored. And then even if you still have lupus, you are living in a different way and with a different amount of symptoms that somebody that has not paid attention and has not addressed it. So I think that is super important. And maybe we can do a follow-up episode where we can talk about those things that we can just start to do to explore this. But with that being said, is there anything, any final words of wisdom that you want to tell our listeners about this topic and about what we have been discussing today here in the show?
You've said so many good things already, but I would love to go into detail at some other time about the specifics. But overall, I will say the first step towards any healing is curiosity, in my opinion. Being willing to look at yourself with tenderness and grace and realize that there is hope, I think is the most powerful thing. Because like I said, the most common thing I see in patients is my grandma had this and my mom has this, and so I'm going to have this. But I love when patients ask the question, what if I don't have to have the same story? Or
Mhm.
what if my story could look different and their story could look different? And so I just would encourage you to always have curiosity about what's going on. Have curiosity about yourself, your story, your health. Genetics are important. They tell us a lot about ourselves, but they are not everything. We can change the way that our genes are expressed. We can change how we reflect on our own choices and our habits and our way that we structure our response to stress. There are things that we can do. It's just a matter of being curious enough to ask what that looks like.
Yes. I'm going to steal this phrase from you with permission.
Yes, yes,
Healing starts with curiosity.
yes.
Any type of healing. And sometimes the curiosity is just even that. I'm going to schedule the appointment and I'm going to show up. Let's see what's going on. Let's see what we find out. So definitely healing starts with curiosity and healing the entire body. So mind, body, and spirit starts with curiosity to pay attention to those parts of us.
Yes.
Lydia, thank you for being here and taking your time to discuss this topic that I'm also passionate about with our listeners. We'll put the show notes a little bit of information about Lydia for those of you that are just curious about the work that she does and where you can find her. And until next time, thank you for being here. It was wonderful. It was a pleasure. Bye bye.
Bye bye. Thank you.
Yes.